Morning, students. Today we'll continue with the GAT physiology. Today we are going to see the salivary glands and the functions of saliva. So you have three major salivary glands, that is parotid gland, submandibular gland, and sublingual glands. And they have the secretion pouring into the mouth. So the name of the secretion is saliva. And these three are major salivary glands, and we have minor salivary glands in the soft palate and buccal mucosa also. Now, what is the function of saliva? Okay, so the salivary functions, number one is it contains the enzyme amylase and lingual lipase. Amylase is an enzyme that digests the carbohydrate. So it is also called salivary amylase or tyalin, and lingual lipase will digest the fat. Second, lysozymes. These lysozymes are bactericidal enzymes that kills the bacteria. Third, it contains immunoglobulin A that provides the local immunity in the mouth. Then it produces mucin. Saliva contains mucin, and they give lubrication. This lubrication is called viscous lubrication, and the lubrication helps in the lubrication of the food, that is for swallowing the food and also for the speech. Then we have antimicrobial proteins like lactoferrin. It's iron binding protein. It is also bactericidal, that is it kills the bacteria. If you look the overall function of the saliva, one is the digestion, other it plays a very important role in the immunity, like immunoglobulins, lysozymes, and lactoferrins. Now, what are the applied aspects in saliva? One is xerostomia, that is dryness of the mouth due to lack of saliva. This may be due to dehydration, or it may be due to drugs. Some anticholinergic drugs, that is the drugs that work against the acetylcholine, which is a neurotransmitter of the parasympathetic division. So these drugs will cause dryness of the mouth. The second applied aspect is silolithiasis, that is appearance of stones in the salivary ducts, and the patient will complain of pain while start eating. So it is also called meal time syndrome, and the stones will block the duct and causes swelling of the gland. And third is mumps parotitis. It is a viral inflammation of the parotid gland by the infection, that is mumps, and it's a viral infection, and they have parotid swelling. And the last one is Sjogren's syndrome. Sjogren's syndrome is an autoimmune disease. It is a autoimmune destruction of the salivary gland and the lacrimal gland. Okay, so it is characterized by xerostomia, that is dryness of the mouth, xerophthalmia, that is dryness of the eye, and parotid gland enlargement will also be seen, but it will not function, it will not secrete the saliva. So the next topic you go for deglutition. So deglutition is the act of swallowing, is called deglutition. It is of three phases: the oral phase, pharyngeal phase, and esophageal phase. The oral phase is a voluntary phase, and pharyngeal and esophageal phase are involuntary phase. And what happens in oral phase? The food is masticated, chewed in the mouth, and it is pushed after mastication, after chewing. It is called as bolus, and the bolus is pushed back to the soft palate. it is pushed against the soft palate. So this was the event in oral phase. It is a voluntary phase. And after this oral phase, so these two pictures you can take it for oral phase where mastication or chewing takes place and food is pushed against the soft palate. The next phase is the pharyngeal phase. It is a very important phase, and this pharyngeal phase is controlled by a swallowing center. The afferent for this phase is the ninth nerve, that is glossopharyngeal nerve, and the efferent is the ninth, 10th, and 12th nerve, that is glossopharyngeal, vagus, and the 12th nerve, that is 9th, 10th, and glossopharyngeal vagus nerve. These two are the very important now, 9 and 10 nerves. Okay. So the afferent is 9th nerve, the efferent is 9th and 10th nerve. And what happens in this pharyngeal phase? There is a movement of the soft palate. See, the soft palate will move and it will close the inlet for nasopharynx. So the food will not enter into the nose. It closes the inlet, so the food will not enter into the nose. So food will not move into the nose. So there is a movement or elevation of the soft palate. The first thing is elevation of the soft palate, closing the inlet for nasopharynx. Second, there is a downward movement of the epiglottis. So here epiglottis is like that, and here it is a downward movement is there. It closes the inlet for larynx. See, larynx will leads to trachea. So it will prevent the food entering the windpipe. And third event is there is an approximation of the vocal cords will take place. And the next event is there will be relaxation of the esophageal sphincter. That is upper esophageal sphincter will get relaxed. So these are the events. So upward movement of soft palate, downward movement of epiglottis, and approximation of vocal cords, and there is a relaxation of the lower upper esophageal sphincter. So these are the events taking place in the pharyngeal phase. The next is the esophageal phase. It starts with relaxation of the upper esophageal sphincter and the food will be propelled along the esophagus. So the first movement in the esophagus is the primary peristalsis, which is aided by the gravity, and it starts with relaxation of the upper esophageal sphincter and food will be passing through the esophagus. The second is the secondary peristalsis. So secondary peristalsis occurs when it occurs, there is a forceful contraction takes place in the esophagus to clear the retained food, and it is more during the lying position. So in the lying position, secondary peristalsis helps in the propulsion of the food. So we have oral phase, pharyngeal phase, and esophageal phase. These are the phases of deglutition. Here, what is deglutition? Apnea. So during the act of swallowing, the swallowing center, which is located in the medulla, they send an impulse to the respiratory center and they will stop the respiration for few seconds so that the food will be entering into the food pipe. So this event, we call it as deglutition apnea. And applied aspect here is the painful swallowing is called as dysphagia. So dysphagia is the painful swallowing. So when food is swallowed with pain, it is called dysphagia. Thank you.